Hey guys, it's Dr. Shah. I am stuck here in the house dealing with this COVID virus issue. I'm healthy, my family's healthy, and we're very blessed in that respect. So while I was hanging out and not being able to see patients in the office other than emergencies and post-surgical patients, I thought I'd do a little series of videos for you on chemical peels. The first one we're going to talk about today is chemical peels that are superficial exfoliants. So I hope you enjoy it, and if you have any questions, you can always contact us at the office. Now, the first category of superficial exfoliants I'm going to talk about are called the alpha and beta hydroxy acids. Now, these are fruit acids that, when initially used in a low strength manner, maybe 5 to 10%, they can be used on a daily basis to superficially exfoliate the skin. This gives the skin a little bit more polish, hydration, and smoothness to it, but it really only affects the external or epidermal layer. Now, one typical alpha hydroxy acid that's very commonly used is called glycolic acid. It's derived from sugarcane, and it basically functions in a lot of overnight creams and daily anti-aging products to allow breakage of the alpha and beta hydroxy bonds in the skin. That those skin cells basically slough off, 1 to 2 cell layers at a time. So it's a wonderful product that's used in a lot of over-the-counter skincare and, of course, in a lot of medical-grade skincare products. Another alpha hydroxy acid is known as lactic acid. Now, this is basically a fruit acid that comes from milk or from milk sugar lactate, and it's gentler than glycolic acid, so it's something that can be used in a facialist's office for gentle removal of superficial dead skin cell layers, and it's wonderful for creating a nice soft and hydrated look to the face. The next superficial exfoliator that I would like to talk about today is called salicylic acid. Now, salicylic acid comes from a chemical compound known as a salicylate, which is basically like aspirin. That makes salicylates and salicylic acid anti-inflammatory, which means they're great for patients that have oily, acne-prone skin. The salicylic acid peels can be done every 2 weeks, and they can really calm down acne. It's great for teenagers because there's not a lot of peeling with it per se, but there is a way to get the skin under control, and then you can go on and use other topicals for suppression of the acne. We're going to now move on and talk about another category of superficial exfoliants. These, however, are a little bit more powerful, and they are known as the retinoids. Now, retinoids are vitamin A derivatives. They can certainly be used daily, but if you use too much, you can see some side effects like extra redness, irritability, too much flaky skin. But they exfoliate the superficial layers, and this thins the epidermis. But they also increase the cell turnover speed at the dermal layer of the skin, causing it to thicken and strengthen. And so this causes an increase in collagen in the skin. The skin gets younger looking. It gets thicker, plumper, holds more hydration, and really makes really, really beautiful skin. Now, the first retinoid topical that we're going to talk about is a retinol. Now, retinol is a very weak form of a retinoid. It basically takes the guesswork out of your skincare. You would use it on a routine basis. You'll get the benefits over time. Its risks are minimal, and side effects are rare with these products. Now, the next retinoid that I want to talk about is known as all-trans retinoic acid, or better known as Retin-A. Now, this is the more powerful big brother to a retinol. It's in its activated form when you put it on the skin, so you don't need to use it as often. It gives you the change that you seek a lot quicker, and if you're greedy with it, you're going to end up with complications like extra redness on the skin, dermatitis, very, very pink skin, and lots of skin flaking. So you want to be careful when you use Retin-A because it really, really works well, and it's fantastic at suppressing acne. So this would be one of those suppressive drugs that you use on your skin after you've used a series of salicylic acid peels to calm down the acne. The Retin-A will hold it at bay.